So yeah, guys, here I am. It's September 30th, 2019. I guess it's 4 days post-op. Um, I got back home from the hospital yesterday, and it sucks that I always look like shit when I'm on these videos because like I kind of don't care, but I want to be as honest with you guys as possible. That's why I'm doing this. Um, it was an ordeal and a half. It's just started, and you know, just like a lot of YouTubers, VSG patients always say, "Oh, why did I do this to myself?" I know that I will eventually overcome that, but right now, especially at the hospital, like, oh my God. Um, I did tell the nurse's assistant, I've told several people that I have bad reactions to morphine, but from now on, I'm going to say that I am allergic to it because I've just realized that hydroxymorphone is less expensive than hydroxycodone. So of course they kept filling my bag with it, and of course I kept throwing up and throwing up and throwing the fuck up. And yeah, I was extremely nauseous. I was gagging like a squealing wounded cat in the hospital for 4 days. If it wasn't for the IV bags, I probably would have dehydrated into a hot mess. And on top of it all, what's even better is they had to give me steroids for the nausea to the point where, yeah, I got home and I gained 4 pounds. Go figure. I'm sure it's a lot of the inflammation and the water weight and just not being home, not enough rest. And it's beautiful. I come home and I have construction going on in my neighborhood for the next month or so, from 7 a.m. to 4 p.m. Constant drilling. My bed was shaking this morning. Yeah, no water. So this morning when I had my first protein shake, which I was really looking forward to, it just tasted so sweet. And like I'm not used to sipping it slowly, so I'm taking not even mint gulps because I can't gulp. I'm not really a gulper. I just took regular drink and I forgot, and I guess it just keeps going down wrong, and I just had some explosive diarrhea. Very unfortunate that it took me about 3 hours to drink half a bottle of that, and it all just came out. I'm really concerned about getting proteins in. I know it's early on. I just took my vitamins this morning for the first time. You see, I've got everything all set up for myself. I'm hanging out in the living room. I've got a recliner. I'm pretty okay. The scar, the wounds, they're not hurting me as much as I thought it would. Like, my doctor did a pretty good job of lining them all up correctly. Maybe I'll show you when they're a little bit more healed up. There's one big one that looks like that's where like the stomach came out from. Looks like a little nipple or kind of like a big belly button above my belly button. They're really sore. I'm glad they're so down low because I've had gallbladder removal before and it was high up, more towards like the middle area, and that did not allow me to sneeze, cough, none of that. Um, yeah, and as far as the gas that's starting to develop, I mean, I see it as a good sign because, yeah, it tells me that my digestive system is starting to work again. Every time I swallow something, it feels okay going down, and then it hits somewhere like in the middle. I'm like, I wish I knew what it looked like. It looks probably like a moon. It feels like a crescent moon. Once it hits a certain part, ooh, it hurts. It hurts, and it's like bubbly and some kind of like gassy kind of like when you flush the toilet and those little bubbles come up at the end. So that's like a little painful. I don't think my body knows where the gas should go yet. And yeah, I'm so glad that I passed gas. I wasn't too happy about the diarrhea, but when I passed gas, I said, okay, things are starting to work again. I'm hungry. Okay, I don't know about other VSG patients. I've read so much information. Everybody's different. Some other people come onto this, have their own channels, and come with the full makeup, full face, ready to go, energy. And yeah, I know I'll get there. I am 46 years old. I'm not old, but I'm not young either. And I have a very hectic lifestyle. So sitting around trying to get better is, I mean, it's a blessing because I do like doing nothing and watching my, shows and marathons. But I do like to sleep too, and it's unfortunate that it's hard to get rest during the daytime when there's construction going on in a quiet neighborhood. Go figure. The month that I'm doing surgery, I've got to deal with this too. I do live alone, so there's some things I need in the apartment, which, yeah, I didn't think about. I mean, I thought about everything. I'm very organized, but this in particular, toilet paper, you know, things like that, Tylenol extra strength. I didn't really get a chance to pick it up. My sister came by. She dropped me off yesterday from the hospital. She's been an excellent support system, as always. Um, I am ready for the pounds to start dropping. I feel like my hair's already falling out. Look at my edges, y'all. I mean, my edges were a little bad anyway. But eventually I will look better. Can't wait to show you what I really look like, because, yeah, I can be cute. A little sense of humor, I guess you have to have it. Try not to be agitated and upset. The gas is so weird. I'm probably going to try to get some of those liquid infant gas drops that I bought. Probably going to try to swallow a little bit of that. Um, yeah, I thought about doing some work from home, but I'm like, hell no. I have to take care of myself, because my job is not going to say, well, she's the best counselor ever. Something happens to me, they definitely won't be at my funeral. So I'll let God take care of this and take the wheel. Please, God, let me get down some more protein. Guys, whatever support you have, I'm definitely eventually going to make this channel a little more formal, and, all the cute little music and all the transitions and the whole, write down the description below and comment below and all that stuff. But right now, I'm effed up. I want to stay hydrated. This is as much as I've been able to drink today. Can you believe it? I thought it was a lot, but it's nothing. That's not even, I think that whole water holder is maybe, we'll say 36 ounces of water in there. So I'm going to try my best to throw that back. The pain meds, I don't really need them too much. I mean, it's discomfort, but it's not pain that any painkiller can do anything about. It's my digestive system is gotten rerouted or whatever, and it's going to take some time to get back to normal, or become what it's the new normal. I don't like all the comments that people say toward me. Everyone is different. I've got a friend, ex-friend, whatever he is. It's like, oh, my place tells me that I should take off for 3 weeks when he does the surgery. That's your business. Everyone's different. I had complications from the anesthesia. That was the worst anesthesia that I could ever have. Dilaudid, all the chemotherapy, radiation, nausea, medicine that they gave me that didn't work, the Zofran, the Regulan, the Blam Blam. Finally, they gave me Decadron, and that worked. I was able to hold down enough tea, water, and some disgusting medicine they gave me because I was low in potassium that, they gave me because I needed it in order to be discharged, to prove that I was hydrated enough. I'm really, really focusing on trying my best to make this, do everything by the book, I didn't just get my body cut open so that I could just go through this journey to lose weight, to wind up gaining it back, to keep going through this yo-yo. Everything that I've had in my life, I've fought hard for, and I have to fight harder for my health. So, practicing new techniques or new ways of thinking about food, about life, about my anxiety levels, and just my body, what it's going to look like, and hopefully eventually soon enough. I'm squinting, guys, because I'm having a hard time seeing with my glasses. I have some new glasses that are ready for me to pick up, but obviously I can't go anywhere. I haven't picked them up yet. So, yeah, I plan to get cuter and sassier and show my real personality, because I know I've been like a miserable wreck on these videos. And I just do it because I didn't realize how therapeutic it would be. I mean, I did, but I'm an introvert. I'm really not like comfortable with sharing my innermost thoughts with strangers, I guess. But I guess once we're part of the weight loss surgery community, it's a whole nother battle. Try not to be judgmental towards others, those people that haven't been overweight too long and opt for the surgery, men and women alike, have not really struggled with obesity. They might have comorbidities. However, I don't think a lot of doctors are doing enough weight management for other people, for other people, and even me. No one asked me to go on a diet. My surgeon just said, "Hey, yeah, you're a candidate. See you in 3 months." 3 weigh-ins, one nutritionist, one psychologist who hardly even looked at me. He didn't even look at my face. So the healthcare industry has a lot of bullshit ass licensed clinicians that see it as a business. It is a business. It's money, right? But you have to understand that like this is the trend now or something. I mean, what happens to good old fashioned, you know, nutritionists and fitness trainers being part of a health plan? You know, um, I've tried it all. I've tried it all. I've gone up and down. I'm a true candidate. I've broken my leg because I'm overweight. I've gotten my gallbladder removed. I have severe obstructive sleep apnea that I've spent thousands of dollars trying to correct. My joints, pre-diabetic, high blood pressure all over the place. I'm too young for this. Okay, I've been overweight since I was 12 years old. I've been at least 200 pounds since freshman year of high school. That's not cool. I'm only 5'2". Right now, when I started my pre-op diet, I was 250 pounds. I gained 20 pounds of that in the prior 6 months to that because of a job. You know, my eating habits, absolutely. However, it's very interesting how you can be eating lunch and a boss can tell you to stop eating because there's an emergency. Meanwhile, when they're hungry, the world stops. They're groggy, you know, they're miserable. You can't approach them. Well, you know what? Everyone has to eat when their body tells them to. And I will never, ever, 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 ever in my fucking life stop eating for anybody because I have a contract, And the job that I'm at now, I noticed someone tried to be slick about it. Say, "Oh, I'll give up my lunch any day in order to help." No, I'm not a martyr. I'm not. I have to eat my food and I have to eat it correctly. Especially now when I get back, I have to take half an hour to eat whatever half a food that I bring to work every single day. I have to drink my water. I have to do it because I work with little kids, and if I have to be dumping in the bathroom or throwing up or not have enough water in my system to hydrate myself to work with these children, I'm doomed. And I don't owe anyone those explanations. So as I continue to empower myself and try to empower others and eventually show you a better side of myself, which is pretty cool. Yeah. Then we'll see how this Phoenix is going to arise, Phoenix Boricua. And for those of you that were watching the video on the day that I had surgery, I'm sorry it got cut off. I mean, I gave you the gist of it. It's, again, you'll never know what you're dealing with until you're there waiting for surgery. The moment that I walked into the operating room and I realized, okay, this is the last moment I have to say, forget it, I'm not doing it. And I was thinking, can I actually do that? Well, yeah, I probably could have, but nah. Obviously, I asked the anesthesiologist to do a countdown, and he didn't. He just put the mask on. I was out. I woke up, and I was just so nauseous and groggy. Ugh, never again. You see, it's like a burp that needs to come up, but it's just kind of like playing around in there. So yeah, it's kind of scary because I go into a lot of things by myself with the Lord first goes ahead of me. But a lot of the major emotional things and physical situations that I've had recently up to now, I've dealt with a lot of it by myself, and I'm okay with it because I spent 3 days in the hospital. I had a nightmare, a roommate from hell the first night. 80-something-year-old woman who didn't even sleep. It talked all night with her friend, and just had no consideration that I just had surgery. And so did she. But then the next 2 nights, they gave me a really nice older woman who was very sweet, and we spoke. But she talked too much, too. Like, just be quiet, people. I don't know what's going on with everyone. It's just, can you just be, like, internal? Oh, God, my edges. It'll grow back, y'all. Something will happen. If not, I'll cut all this goddamn hair off. So, yeah. I think that's enough talking for now. Finally home. Feel comfortable at home. Yes, my home doesn't smell funny. My bathroom is totally clean. No weird contraptions and lights on in the hallway. Hospitals, when they're taking care of you, it's a wonderful thing. But when you're ready to go, you're ready to go. If I could show you all the bruises that I have on my body from all the injections and all the IVs and all the, oh my God. Yeah, I look like somebody beat the shit out of me. But I believe these scars will heal very quickly. There's no stitches. It's just like surgical glue or something. You know, it's a sore feeling. It's not as bad as I thought it would be. But it's coming awake. Those intestines are waking up. And it's like, where is everything? What's going on? Yeah. So if I can't lose weight after having my gallbladder removed and half my stomach removed, then I don't even know what would be the point of this all. I'm going to listen to my body. And I'm going to exercise when I'm ready. When my body is able to hold more calories. Yeah, I didn't get this surgery so I could get in the gym next week. Bullshit. Let's be real. I'm overweight because I have problems getting to the gym because my body hurts from being overweight and my joints. You know, you hear that construction? It's annoying, isn't it? Ah, oh, jeez. Yeah. It's going to be very difficult to go to the gym until maybe like December, and that's fine. I just want to be active. You know, I gotta make sure my proteins are in so my muscles are not deteriorating. You know, thank God for the beautiful friends that I have who have volunteered their time and effort into, you know, making me feel better. You know, giving up some of their time and volunteering themselves to come help me. But I'm fine. I'm fine. There's really I don't need any food. You know, I can't have food. When I had a broken leg, ain't nobody asked me if they wanted me to bring if they wanted to bring food. Go figure. Again, I'm not ungrateful, but I got this, you know. Yeah, it's a gesture. It's a beautiful gesture, and I appreciate it with all my heart. I know people do concern themselves about me, as well as I concern myself about others. Maybe a little too much sometimes, but I'm learning how to do that for me. Yeah, my son, he's fine. He's a little sad about not being able to come home till I get better because he requires a lot of attention, and I'm just not. I'm not feeling it. I don't need to feel guilty about not being able to perform my motherly skills, duties at this point. My son's a big boy. So I'm going to sign off now. I pray that when I come back, I look better. I fix my hair. I've got new glasses, whatever it takes. I'm not vain. I know I'm cute, but I don't need to show it right now. So I hope that this is going to help someone who's thinking about the vertical sleeve gastrectomy. Oh, I'm feeling pain. Ooh, it's going to pass. Yeah, I know there's so many questions. If you would have told me that I was going to do this in the beginning of the summer, July, June, I would have said, hell no, I'm not doing that. I even went on a consultation to go get I forgot the name, the orbital. It was like a ball that they swallow. You swallow. $6,000 would have went down the drain because I would have took it out the first day. So yeah, if I would have, nobody would have ever been able to predict that I was going to go through with this. So hopefully soon my double chin starts going down a bit, you know. I'm down to maybe 2. This morning I weighed myself, I think it said 239. But when I went into the hospital on Thursday, I was 234. Every damn scale is different. I don't really care. I'm not really into measuring and being all precise. I know when I've lost weight. I can feel it. To me, a milestone will be once I get to 199. I have not been 199 since 9th grade. So, yeah. And I'm going to celebrate those little milestones, those huge milestones. I'm not going to diminish it, and I don't need to celebrate with food. You know, I will find a way. I will praise the Lord. I will have a good time. I will shop for a new pair of sneakers, whatever I need to do to celebrate, even if it's quiet time, whatever it has to do. This is a transformation from the inside out. You know, I'm not going to be fake and phony and say, oh, I don't need certain people, or, you know, I don't really want to communicate with certain people too often because the state of mind of people can be quite alarming sometimes in the way that they deal with other people's emotions. And I am very, very aware of that because of my profession and because of the person that I am in itself. I really don't try to hurt people's feelings, but I don't really, and I know sometimes people don't try either, but it just happens that way because they're not sensitive, they're insensitive, they're not empaths, and it's okay not to be one, but then if you're not, then shut up, okay, because that's where I am at in life, and I really like it, and I can't wait till I come out and show out and grow out and do out and all that. So, again, clocking off. I'll see you soon, hopefully in the next few days. If not, when I lose a significant amount of weight, 5 pounds maybe, I'll come back on, all right? Thanks a lot, guys. And if you have any comments, just let me know. Comment down below. I would love to hear what you guys think of my journey. Please don't be mean, because I'm not in the mood. I really, really don't need that. There's enough meanness going on in this world as it is. Let's just feed each other light, and support. I would love to give you any information that I've researched, that I've found helpful through YouTube, through friends of mine who have had the procedure, through family members as well that have not had the procedure but have lost a ton of weight on their own. And this is not the easy way out, people. This is just a tool. So anyone that tries to say, oh, you had to do the surgery, oh, you're lucky, oh, you went and did the surgery, oh, you just did it quick, wow. Yeah, okay, try ripping your stomach open, and yeah, not guaranteeing that you're going to lose anything. Anyway, you still got to shut your mouth. You still got to keep active. You still got to do vitamins. You still got to do it all. This has been the most discipline that I've had in a long time, if ever. Okay? So, guys, again, take care. Talk to you soon. Bye.